Hi, everyone. Thanks for having me. I will say this is my favorite talk to give, just in general in cardiology, but also particularly to SCAD survivors. So we're going to do what I call a speed dating through lifestyle medicine. And I think, as has been mentioned numerous times today, please give yourself grace. You don't have to do all of these things perfectly. And a lot of these topics are nuanced and need to be individualized with your provider. But we're going to go through all of these pillars, as we like to call them, of lifestyle medicine. And shout out to the Stanford Lifestyle Medicine crew for encouraging my addition of one more pillar at the end of the talk that you'll see. So the first one is you are what you eat, so your nutrition. We could talk all day about the new pyramid that's out, but we're going to go old school and just do the good old pyramid that we had before. The Mediterranean and the whole food plant-based meal plans have been shown to reduce the risk of major cardiovascular events, not specifically for SCAD, but they're known to be these beautiful anti-inflammatory, healthy food plans that kind of make you feel better mind and body. And there's really no downside to using them as your guides moving forward. Meal plans can be modified to be culture specific. So Catherine Leon and I are on an anti-AI crusade. But what I will say ChatGPT is good for is you can write, make a meal plan of South Asian meals such as X using the Mediterranean meal plan outline, and it'll give you some beautiful recipes. So that's a great way to use AI to kind of get cultural specific or specific to what you have in your fridge. And it makes it easy for those busy folks out there in the conference. I do recommend that you eat your vitamins unless known to have a critical deficiency diagnosed by your physician. That being said, talking about multivitamins, vitamin D, other supplements to a healthy food plan, you should discuss with your physician. Don't try to change your eating behaviors overnight. So we know that what we call yo-yo dieting is bad for the heart. And you'll notice intentionally, I try to not call it a diet. It is a meal plan, mainly because we don't, particularly as women, want to focus on that term because it can be a little bit loaded and triggering. The number two, so get active. Again, a very loaded topic. We're going to talk about this more in the next talk with Dr. Phelan. What I will say, and a lot of us have talked about it, is consideration for cardiac rehab to reintroduce activity in what we sometimes call your new body is important. As has been mentioned, cardiac rehab is very variable. And in terms of availability, in terms of robustness, in terms of perhaps SCAD specific tips and tricks, but as best as one can, some form of cardiac rehabilitation program to gain confidence getting back to activity is important. You'll hear there's no clear long-term evidence-based exercise recommendations, but there are experts to help. So what I will say about this very briefly, and all of these pillars could be a talk for an hour on their own, is find a team that will tailor it to your needs rather than giving cookie cutter recommendations. I think that's really important. Everyone comes into this diagnosis with different levels of fitness and activity prior to SCAD, and different concerns after the event. So it's important to find a team that listens to you, that hears you, and tries to individualize activity for you moving forward. Number three, control your risk factors. So we talk often about how a lot of SCAD patients, a lot of these risk factors don't apply. That being said, I will say that I think that you will see much more variety and risk factors coming into SCAD than we previously believed. And I think the main one that we're increasingly recognizing perhaps has been undertreated is blood pressure. So the days of saying 140/90 are fine, perhaps well, almost certainly not for a SCAD patient. So I think it's important to monitor your blood pressure, not obsessively, but just kind of get a sense for your average blood pressure and come back to your care team if your blood pressures are consistently running over 120s, over 80s. There's also other things. I think lipo little a, Marnie mentioned, I'm a big fan as well. So making sure that you're getting your cholesterol risk profile evaluated. If you have rheumatoid arthritis, lupus, psoriasis, any kind of inflammatory process, making those things are under control. Of course, we say no smoking, maintain a healthy weight, manage your blood sugars. So that's our third pillar. Number 4, which Dr. Sumner went over and is dear to my heart as well, as the mind-body connection, as we all know, is real. And this is a really, also a topic in and of itself and on its own. I think, we all have stress, we all have anxiety, we all have depression at various stages in our lives to various degrees, one maybe more than other, and there are good periods of life and more challenging periods of life. But I think the important thing is recognizing when you're going through those challenges and seeking out care to help to modify your response to those stressors. And as has been mentioned before, sometimes this is harder said, closer to the initial diagnosis, and gets a little bit easier to kind of sort out as you get further from the diagnosis. We do know that that kind of constant cortisol release of maladaptive stress, as we like to say, is linked to the development of cardiovascular disease, and a lot of depression, anxiety, increases in stress are common after all cardiovascular diagnoses and cardiovascular surgery as well. And as you've seen, we've done work within our group looking at PTSD and other components of the mind-body connection. And we're really trying to work on finding tools for SCAD survivors to use in this space. Natural sleep. So there's all kinds of supplements. One of my girlfriends the other day was like, I spray magnesium on my feet to go to sleep, which I'd never heard about. And magnesium doesn't really get absorbed through your feet well, but I will say, as was mentioned earlier, I think magnesium can be a tool for sleep. That being said, if at all possible, to find natural sleep of 7 to 9 hours a night would be important. This is a loaded topic for those who are going through hormonal changes of midlife. Sleep is a huge component, and quality of sleep is a huge component of that period of life. So sometimes this is not going to be perfect. But if there are things that one could do to improve sleep hygiene, it can decrease your risk of high blood pressure, depression, anxiety, insulin resistance. And it's interesting because in clinic, you'll often ask folks, how their sleep is, and they're like, oh, my sleep is fine. But then when you do scheduled kind of questionnaires and systematically look at sleep, there is room for improvement. Number 6 is social connection. So as many of you probably know, in the 2023 Surgeon General's report, this was noted to be an epidemic of its own. And so finding social connection within your SCAD community and outside of your SCAD community is a hugely important space. And number 7, the additional pillar, gratitude and reflection. I always recommend this book by Suleika Jawad. It has its own beautiful story, but essentially during the pandemic, she recruited her friends, who were mostly writers, to give a story prompt and then a proposed journal entry related to the prompt. And you can do it for 100 days. So each day you do a new prompt as you go through. She's a 2-time cancer survivor who is going through a 3rd diagnosis of cancer now. And she just has this beautiful soul. And I find the book incredibly uplifting and kind of helps with that practice of gratitude and reflection. Of course, many other people have other means by which they think they can kind of focus on this pillar. One quick word on incorporating alternative therapies. Just remember, the FDA does not monitor these types of things. Please let your doctors know if you're taking alternative therapies. The data's soft, but there's all these, beautiful things in the alternative space that may be okay or appropriate or considered for you. So just make sure you talk to your doctors about that. And some resources. I did do YouTube lifestyle medicine talk on the SCAD Alliance page, which I probably should update, but it goes in a little bit more detail about these things. Shout out to the Stanford Lifestyle Medicine Group. I would strongly recommend not starting to follow their recommendations, but rather bring the tidbits that you read back to your care team to see if there are areas that you could focus on. The American College of Lifestyle Medicine has good resources, and there are all these beautiful food as medicine conferences and beautiful locations that you could research as well. And that's a very whirlwind tour of lifestyle medicine. Thank you so much for having me.